Hello and welcome to Lyra Nara. In this video we continue to talk about one of the most important organs in our body, and that is of course our kidneys. If you follow our channel regularly, then you know that in the last video we concentrated on natural solutions to keep your kidneys well functioning and healthy, such as nutrition, supplements, etc. If you haven't watched the video yet, I will link it in the description box below. Highly recommend it. In this video, we're going to concentrate on chronic kidney disease that usually leads to dialysis. And we're going to show you a surprising, inexpensive natural solution that will help you avoid dialysis with its many negative side effects. But before we do that, I would like to remind you that we still have some great deals on some of the best holistic health devices going on at Lyra Nara. Link in the description box below. Take advantage, don't miss out on this unique opportunity. So, without further ado then, let's learn more about chronic kidney disease, dialysis, the pros and cons, and a very surprising, inexpensive solution and alternative to dialysis that is very well scientifically researched, as you will see. So, kidney disease and kidney failure means that the kidneys are damaged and cannot filter the blood the way they should. And this can cause waste to accumulate in your body, and therefore kidney disease can cause other health problems such as heart disease. Having acute or chronic kidney failure increases your chances of having a stroke or a heart attack. Major risk factors for kidney disease include diabetes, high blood pressure, and a family history of kidney failure. Chronic kidney disease, or CKD for short, means simply that you have a reduced kidney function over a long period of time. And chronic kidney disease may develop over many years and lead to what is called ESRD, or end-stage kidney or renal disease. And CKD, or chronic kidney disease, develops in 5 stages. Stage 1 is that your kidney are damaged, but you still have normal kidney function, meaning that you have an estimated glomerular filtration rate, or GFR for short, of higher than 90 milliliters per minute per 1.73 square meters. And it comes with a persistent proteinuria of more than 3 months. Then it develops into stage 2, where you have kidney damage with a mild loss of kidney function. Your estimated GFR is at 60 to 89 milliliters per minute, and you have proteinuria persistent for more than 3 months. In stage 3, you have mild to severe loss of kidney function and an estimated GFR of 30 to 59 milliliters per minute. In stage 4, you have a severe loss of kidney function with an estimated GFR of 15 to 29 milliliters per minute. And in stage 5, you have kidney failure that requires dialysis or a transplant for survival. It is also known, as mentioned, as ESRD. Here you have an estimated GFR lower than 15 milliliters per minute per 1.73 square meters. What is dialysis then? Well, it's a kidney treatment to filter waste and water from the blood. Because when your kidneys fail, you need something to filter the blood artificially. And the 2 main forms of dialysis are hemodialysis and peritoneal dialysis. We also need to explain the term proteinuria. That is a condition in which the urine has more than normal amounts of a protein called albumin. And surprisingly enough, the overall prevalence of CKD in the German population is at approximately 14%. More than 661,000 Americans have kidney failure. Of this, 468,000 individuals are on dialysis, and roughly 193,000 live with a functioning kidney transplant. High blood pressure and diabetes are the main causes of chronic kidney disease. Almost half of the individuals with the CKD also have diabetes and/or self-reported cardiovascular disease. And kidney disease often has no symptoms in its early stages and can therefore go undetected until it is very advanced and you need dialysis therefore. And also each year kidney disease kills more people than breast or prostate cancer. In 2013, for example, more than 47,000 Americans died from kidney disease. And those are quite worrying numbers, I'm sure you will agree. Let's discuss the two types of dialysis in more detail next. First up, hemodialysis. Hemodialysis is the most common type of dialysis, and this procedure uses an artificial kidney, also known as hemodialyzer, to remove waste and extra fluid from the blood. The blood is drained from the body and filtered through this artificial kidney. The filtered blood is then returned to the body with the help of a dialysis machine. To get the blood to flow to the artificial kidney, your doctor will perform surgery to create an entrance point, a vascular access into your blood vessels. And the three types of entrance points are: first, arteriovenous or AV, connecting an artery and a vein, and it's the preferred option. Then we have the AV graft, and this type is a looped tube. And the other version is a vascular access catheter, and this may be inserted into the large vein in your neck. Both the AV fistula and the AV graft are designed for long-term dialysis treatments. People who receive AV fistulas are healed and ready to begin hemodialysis 2 to 3 months after the surgery, and people who receive AV grafts are ready in 2 to 3 weeks. Catheters, on the other hand, are designed for short-term or temporary use. Hemodialysis treatments usually last 3 to 5 hours and are performed 3 times per week. However, hemodialysis treatment can also be completed in shorter, more frequent sessions. Most hemodialysis treatments are performed at a hospital, a doctor's office, or a dialysis center. And the length of treatment depends on your body size, the amount of waste in your body, and the current state of your health. After you've been on hemodialysis for an extended period of time, your doctor may feel that you are ready to give yourself dialysis treatments at home, and this option is more common for people who need long-term treatment. The second type of dialysis is called peritoneal dialysis. And peritoneal dialysis involves surgery to implant a peritoneal dialysis catheter into your abdomen, and the catheter helps filter your blood through the peritoneum, which is a membrane in your abdomen. During treatment, a special fluid called dialysate flows into the peritoneum, and the dialysate absorbs waste residues. Once the dialysate draws waste out of the bloodstream, it's drained from your abdomen. This process takes a few hours and needs to be repeated 4 to 6 times per day. However, the exchange of fluids can be performed while you're sleeping or awake. And there are numerous different types of peritoneal dialysis, the main ones being continuous ambulatory peritoneal dialysis, or CAPD. In CAPD, your abdomen is filled and drained multiple times per day, and this method doesn't require a machine and must be performed while awake. The other type is called continuous cycling peritoneal dialysis, or CCPD, and this uses a machine to cycle the fluid in and out of your abdomen. It's usually done at night while you are asleep. Then we also have intermittent peritoneal dialysis, or IPD for short, and this treatment is usually performed in the hospital, though it may be also performed at home. It uses the same machine as CCPD, but the process takes longer. The problem with all of these types of dialysis is that they come with many risks, and that's why people who are on dialysis usually have a reduced lifespan. The risks for hemodialysis include low blood pressure, anemia, meaning not having enough red blood cells, muscle cramps, difficulty sleeping, itching, high blood potassium levels, pericarditis, which is an inflammation of the membrane around the heart, sepsis, bacteremia or a bloodstream infection, an irregular heartbeat, or even a sudden cardiac death, which is the leading cause of death in people undergoing dialysis. For peritoneal dialysis, the risks include an increased risk for infections in or around the catheter site in the abdominal cavity. For example, after catheter implantation, a person can experience peritonitis. And peritonitis is an infection of the membrane lining of the abdominal wall. Other risks are abdominal muscle weakening, high blood sugar due to the dextrose in the dialysate, weight gain, hernia, fever, and stomach pain. Dialysis is also very time-consuming and expensive. Not everyone chooses it, particularly if they are experiencing severe acute kidney failure. If you decide not to pursue dialysis, there are other treatment options that may help manage your symptoms, however. One of these options is called anemia management. When the kidneys are working properly, the hormone erythropoietin, or EPO for short, is produced naturally in our body. To help with an underfunctioning kidney, you can get, therefore, an injection of EPO every week. Also, maintaining good blood pressure can help slow down the deterioration of your kidneys. But there is another surprising method that has been researched recently that works really well. Let's see what that one is. And that astonishing, inexpensive solution, believe it or not, is pharmaceutical grade bicarbonate, also better known as baking soda to you and me. But before we show you how bicarbonate works and helps you prevent dialysis, first let's talk a little bit more about how this chronic kidney disease starts and develops. So we have the primary glomerular kidney condition, meaning acute glomerulonephritis, antibasal membrane antibody nephritis, Goodpasture syndrome, chronic diffuse proliferative glomerulonephritis, herd nephritis, and rapid progressive glomerulonephritis. Then we have the congenital abnormalities of the kidneys, such as kidney hypoplasia and medulla polycystic kidneys. Then we have the primary kidney collecting tubules disease, meaning chronic hypercalcemia, chronic potassium deficiency, Fanconi syndrome, and heavy metal toxicity. And then we have vascular conditions such as ischemic kidney disease, bilateral kidney arterial stenosis, bilateral fibromuscular hyperplasia, malign phase of essential hypertonia, and nephrosclerosis. How does this sodium bicarbonate therapy work then? Well, the kidney's diuresis main filtration work is disturbed or even completely suspended in CKD conditions, meaning that the kidneys cannot concentrate fluids, they cannot dilute fluids, and they cannot excrete acidic waste such as the uric acids. Diuresis capabilities develop during the embryonal kidneys ontogenesis, and the embryo uses ocean saline solution to develop further the kidney's functions, and this is called diuresis, and of course also for developing the kidney collecting tubules. Dr. Kopp's sodium bicarbonate solution corresponds to this composition of a saline solution used by the embryo. And this phenomenon was widely studied, and you can find a lot of studies, go to pubmed.gov and other sites, and there have been also even articles in the mainstream media about this. Many scientists and doctors have studied this, such as Dr. Snerman, Dr. R. Skrier, Dr. Grieger, Dr. R. Pitts, and many others. And thus sodium bicarbonate is the mediator of GTB. And patients with high chronic kidney disease risk are people with a kidney insufficiency with creatinine of 1.6 milligrams per deciliter, people with an age over 60, diabetic patients with systemic conditions, patients with only one kidney. Also, another risk factor is nephrotoxins, exogen, meaning pesticides, ethylene glycol poisoning or mushroom poisons. Nephrotoxins endogen, that is caused by sepsis, oxalates excess, hyperuricemia, as well as hemolysis. Then dehydration and diarrhea, and the consumption of NSAIDs, cytostatic drugs, and antibiotics. And in the graph here on the right, you can see the filtration, resorption, and the excretion, and how it depends on sodium bicarbonate concentration in your blood plasma. And urine can be excreted, and it is possible only above a plasma concentration in sodium bicarbonate of 28 mmol, as you can see from this graph. So this sodium bicarbonate is very important. The explanation why this sodium bicarbonate therapy works is that the kidney diuresis is very similar in an embryo and in sodium bicarbonate polyuria, as you can see from these two graphs that show you the kidney tubules. On the left you have the diuresis in an embryo, and on the right you have the diuresis in sodium bicarbonate polyuria. And you can see that it's very similar. And this is the theory that is put forward for explaining why this simple therapy brings such great results. So it's time now to sum it all up and come to some conclusions about what we've learned today. First, we've seen that CKD, chronic kidney disease, affects hundreds of thousands of people. It leads to more deaths than prostate cancer and breast cancer. And we've also seen that the normal solution for CKD nowadays is dialysis. And dialysis works. Unfortunately, it comes with many side effects. It's also very expensive, and it makes life very uncomfortable. And that is why people who are on dialysis have a reduced lifespan. The good news is, as we've seen, that there is a very inexpensive, simple solution to CKD, and that is sodium bicarbonate solution. And it has been shown in scientific studies that patients have the following benefits when they follow a sodium bicarbonate treatment. There is a significant reduction in the number of patients who need dialysis by more than 85% actually. There is also a significant increase in the patient's lifespan and a reduction of CKD death cases. There is also a significant reduction of kidney transplants and the need for them. It's also been shown that patients who follow COPS sodium bicarbonate therapy do not show side effects, risks, and other health damages compared to dialysis patients. And there is also, of course, because of that, or there could be, if this would be more widely used, a significant reduction in healthcare expenses when it comes to CKD. Dr. Kopp treated in 1 year only over 300 patients with CKD and reached an overall success rate of over 80% in even very difficult cases. This procedure has also been used in other countries such as Japan, China, and everywhere it showed great success. This procedure was also used in the US by Dr. R. Pitts, And in 2019, a large study was conducted about the use of sodium bicarbonate therapy in CKD, and the results were also very, very promising. So you might ask yourself, why is this life-saving procedure that has no risk or side effects and costs a fraction of dialysis not routinely used by our healthcare system? And I leave the answer to you to figure out. I'm not going to go into politics, but if you read all the studies, you're gonna start asking yourself this. I highly encourage you to further research this subject. If you have questions, we are here, of course, also for you to answer them. Just give us a call, 1-888-773-3196. That is 1-888-773-3196. If you've enjoyed this presentation, please also support our work by liking, sharing and subscribing. Hit also the notifications button, that is the little bell icon on your screen, so you don't miss out on the holistic health content that appears on this channel weekly. And also do not forget about the deals that we still have available at lyra.com. You save hundreds of dollars on some of the best holistic health devices available on the market today. Link in the description box below. And with all that being said, stay healthy. Until next time.